I'd just like to talk very, very briefly about the things that are needed and the things that are not needed. Top of the list, and you've heard Dr. Tedros say it again and again, solidarity. And previous speakers hinted at this as well. This kind of outbreak and challenge requires working together in a way that is perhaps not typical of our day-to-day. I think one speaker mentioned people we're sometimes in competition with, we have to work together with. And so this solidarity and unity of action is really important, as is equality of access. The things that we are going to provide to support governments with and countries with, communities with, have to be made equally accessible to all. Whether it's testing, whether it's treatment, diagnostics, medicines, other supplies, in many cases, in some communities, food and water. And we're going to probably see, unfortunately, in the coming weeks, some parts of the world where basic water and sanitation are not something people can take for granted. And that presents immense issues for an outbreak such as this. Responding where the needs are greatest and where people are most vulnerable is something we're tracking daily, and which we will be matching up the support that comes in through the response fund and other mechanisms to get what people need most to where it's most urgently needed. And then supporting the national government's response plan. And even as Margaret mentioned off the top, locally, but also nationally, where you can be part of the plans that are in place or that are shaping to help governments with what they need or with what they can't do as well as you can. What's not needed? Ignoring public health advice. We've seen some governments have to take stronger measures because people aren't heeding the public health advice. It's hugely important. Any role you can play in educating and informing your staff, your clients, your networks is really valued by us and by others, because that will help us deal with this as quickly, efficiently as we can and save as many people's lives and health as we can. Starting new initiatives where there are similar ones that already exist or things in place is another one. It's difficult sometimes. We know it's a complex world we live in. There's a lot of agendas, a lot of different things we need to be conscious of, but build on the existing, work together. And finally, this relates very much to the in-kind contributions. Donating things that do not meet quality standards is something we really have to try to avoid. So if you are repurposing, or if you are looking at producing or procuring things that you don't normally, look for the standards first. We have already received many offers that just do not meet WHO's quality standards, so they're not something that we can send to countries. We are working in tandem with the revised plan to make those specifications as easily and widely accessible in our dialogue with industry associations, so that whatever people are producing or contributing meets the standards, and we can accept it or help channel it to the people who need it.